I'm Leslie Tweed, and I am the founder of Tendercare. One of the things I didn't like when working with another home care company is I felt like when I called in, no one knew what my name was or what I did really. I was just a number to them, and I wanted our company to be different.
In the early days of Tendercare, we would drop our nursing notes off at the farmhouse where Leslie started the company. The people who worked with her in the office, they would all their kids would be there. You could tell from the very beginning that the family was the most important part of why she started Tendercare.
Even from the early days, when I was a kid, you could tell that what Tendercare did was very important. You could feel a deep appreciation from all the patients and their families, and what we were doing was important to their lives. Everyone wanted to be at home with their family unit, so it makes it a beautiful thing when you can earn a living helping people be where they want to be and supporting people that need you the most.
Growing up in the business was extremely impactful. I saw my parents work every day to try to fulfill promises not only to patients but employees, and really try to treat everybody the way they would want to be treated. Over the years, they really taught us all what it means to work hard, to put people first, and to be extremely selfless and loving towards everybody around them. We've been family owned and operated for over 30 years. We provide expert experience for all things that are Medicaid and home care. We want to make sure that they feel seen and that they're not alone. That's why we have patient navigators. We have 24/7 on-call nursing, or they want to be a family caregiver. We're here to walk them through that process and get them the training and all the information that they need so that they can take care of their loved one and keep them at home. Skilled nursing in home has an incredible impact on families' lives. Burnout is a real thing in the family caregiver workforce. So Tendercare offers trained, licensed caregivers to go into the home so the families can really have that balance of life and keep their loved ones at home.
I'm Will Kuhn. I'm 34. I have muscular dystrophy. I live at home on a ventilator, and Tendercare's been such a life-changing thing for me to gain my independence. They don't just treat it as a job, they treat it as being part of the family.
I am William's primary caregiver, and now I'm also part of Tendercare as well. And now I can have my mom cap and my Tendercare cap, and they both work very well.
The thing that really builds trust and connection with families, it's being present. They really want to be seen and heard and supported. The other thing is doing what you say you're going to do. Families are navigating really complex systems, and so for Tendercare to be able to take some of that navigation responsibility off of their plate and follow up and follow through means a lot to families.
The thing that caregivers and employees of Tendercare need the most is our support. They need to know that we are there for them, and when they're in the field taking care of patients, if they have a problem, then they can reach out and talk to us.
We do offer longevity in their position, flexibility in their schedules, but then also it's a nice way to still be able to work as a nurse and as a caregiver while still avoiding some of that hospital burnout.
The one thing I want families and caregivers to feel when they think of Tendercare is peace. And that peace comes from building trust with not only our staff, but the families, that they can trust the caregivers in their home and that our staff can trust that we're going to treat them the way they want to be treated.